11 o'clock at night, lights off, you are in bed, phone in your hand, scrolling. Maybe it is the news, maybe a video, maybe you are just checking tomorrow's weather. You do this every single night, and you have never once thought twice about it. You should. What you are doing in those final 10 minutes before you close your eyes has a direct, measurable effect on your heart, your blood pressure, and your risk of a cardiac event while you sleep. Here is a fact most people have never heard. The majority of heart attacks do not happen during exercise. They do not happen while you are shoveling snow or running for a bus. They happen between 4 o'clock and 6 o'clock in the morning, while you are lying in bed, asleep, doing nothing. And what you did in the hour before sleep plays a bigger role in that than almost anything else in your entire day. 15 years of clinical cardiology, I have watched patients walk in after a nighttime cardiac event, and when we sit down and reconstruct the evening before, it traces back to habits they never once questioned. Not a single one of them thought those habits were dangerous. Every one of them was wrong. Subscribe and hit like right now. What I am about to explain is not covered in a standard checkup. The system bills for stents and stress tests, not for teaching you how to go to bed safely. Help Dr. Johnson reach 100,000 subscribers. Every single one counts. To understand why your bedtime habits matter so much, you need to know what is supposed to happen inside your chest when you lie down. During the day, your sympathetic nervous system, the body's fight-or-flight branch, keeps your heart alert and responsive. It maintains your blood pressure, keeps your heart rate ready to react, and pumps out stress hormones so you can function. That is normal. That is daytime mode. At night, a different system is supposed to take over. The parasympathetic nervous system, the rest and digest branch, steps in and does the opposite. Heart rate drops. Blood pressure dips by 10 to 20%. Cortisol, the primary stress hormone, clears from your bloodstream. The heart enters a genuine recovery phase. This nightly dip is called nocturnal dipping, and it is not optional. Without it, the heart never truly rests. It accumulates micro-damage night after night, the kind of damage that does not show up on a stress test until it is far too late. Here is the problem. Certain bedtime habits prevent that parasympathetic takeover from ever happening. The sympathetic system stays partially active, heart rate remains elevated, blood pressure does not dip the way it should, cortisol lingers in circulation hours longer than it is supposed to. Over months and years, this produces a state cardiologists call non-dipping hypertension, one of the strongest independent predictors of heart attack and stroke during sleep. And the habits that cause it are things you do every single night without a second thought. By the way, a lot of you have already been checking out Care Health on my channel page. If you have not looked at it yet, it is the link right there on the channel page. More on that later. Let me show you exactly what those habits are. Let us start with the most obvious one. The screen itself. Not what is on it, the light coming off it. Your phone emits blue spectrum light. That light hits your retina and sends a direct signal to a structure deep in your brain called the suprachiasmatic nucleus, your body's master clock. That signal says one thing: it is daytime. Stay alert. In response, your brain suppresses melatonin. Most people think of melatonin as just a sleep hormone. It is not. Melatonin is a direct cardiovascular protector. It lowers blood pressure. It reduces oxidative stress on the inner walls of your blood vessels. It slows heart rate and helps the cardiac muscle shift into recovery mode. When blue light hits your retina within 60 minutes of sleep, melatonin release is delayed by 90 minutes or more. That means even after you put the phone down and close your eyes, your heart is not getting the hormonal signal to rest. Meanwhile, cortisol, which should be declining steadily through the evening, stays elevated. Cortisol keeps blood vessels constricted. It raises heart rate. It makes blood platelets stickier, which promotes clot formation. Think of it as a seesaw. Melatonin on one side, cortisol on the other. In a healthy evening, melatonin rises and cortisol falls. That seesaw tips toward recovery. When you stare at a screen in bed, you hold the seesaw locked in the wrong position. Cortisol stays up. Melatonin stays down, and your heart enters sleep, still running in daytime mode. Clinical data confirms this. People who use screens in bed have measurably higher resting heart rates during the first 2 hours of sleep compared to those who do not. That is not a comfort issue. That is cardiac workload the heart was supposed to be spared from. Now here is where it gets worse. Because it is not just the light. It is what you are looking at. Think about what fills your screen at 11 o'clock at night. News headlines about disasters, political arguments, a work email from your manager, a financial update you were not expecting, a comment section full of people attacking each other. Every single one of these activates a structure in your brain called the amygdala, the threat detection center. The amygdala does not care whether the threat is a tiger or a tax bill. It reacts the same way. The moment it fires, your adrenal glands release adrenaline and cortisol into your bloodstream within seconds. Heart rate jumps, blood pressure rises, blood vessels constrict. Your body shifts into a low-grade fight-or-flight state. And here is the part people do not understand. This activation does not stop when you put the phone down. The hormonal cascade that your amygdala triggered takes 45 to 90 minutes to fully clear from your system. If you read a stressful message at 11:15 and close your eyes at 11:20, your cardiovascular system is still running in stress mode at midnight. You feel like you are resting. Your heart is not. It is pumping against constricted vessels at an elevated rate with sticky, clot-prone blood during the exact hours when it was supposed to be in its deepest recovery. Stress mode sleep is where cardiac events breed. In my practice, I see a clear pattern. Patients who report checking work email or news before bed consistently show a higher incidence of nighttime arrhythmias on Holter monitoring than those who do not. The phone is not just stealing your sleep, it is putting your heart into a state it was never designed to sustain through the night. The third mistake has nothing to do with your phone. It happens at the dinner table. When you eat within 2 hours of lying down, your stomach is still actively digesting. Digestion requires blood flow. A significant volume of blood gets diverted to your stomach, your intestines, your liver, away from your heart. Your heart is now pumping with a reduced share of the circulation while simultaneously being asked to shift into rest mode. That alone is a problem. But there is a second mechanism that most people have never heard of. When you lie flat with a full stomach, gastric acid can push upward into your esophagus. That is reflux. Most people think of reflux as heartburn, a discomfort issue. For your actual heart, it is something else entirely. Running directly alongside your esophagus is the vagus nerve, the longest nerve in your body, and it connects straight to your heart. When stomach acid irritates the esophageal lining, that irritation travels along the vagus nerve and disrupts your cardiac rhythm. It can trigger premature ventricular contractions, those skipped beat sensations, and in some cases even brief episodes of atrial fibrillation. I have had patients come in terrified, convinced they have serious heart disease, when the actual trigger was a plate of pasta 90 minutes before bed activating their vagus nerve through acid reflux. And there is a third layer. Late-night eating, especially carbohydrates, causes a spike in blood sugar. Your pancreas responds with insulin. Insulin signals the kidneys to retain sodium. Sodium holds water. Blood volume increases overnight. Your heart now has to pump a larger volume through the same vessels during the hours it was supposed to be resting. One late meal. 3 separate mechanisms hitting your heart at once. This is the one nobody thinks about. You get into bed, you find a comfortable position, and you assume that is the end of the decision. It is not. How you position your body while you sleep directly affects how hard your heart has to work through the night. Start with lying flat on your back with no elevation. In that position, gravity is no longer pulling blood down into your legs. Everything that was pooled in your lower body during the day rushes back toward your center. Venous return to the heart increases sharply. For a young, healthy heart, that is manageable. But for anyone over 50 with even mildly reduced cardiac function, the kind of subclinical heart failure that has not been diagnosed yet because it produces no dramatic symptoms, that sudden increase in volume can overload the right atrium. The heart recognizes the overload and releases atrial natriuretic peptide, ANP, a hormone that tells the kidneys to dump fluid immediately. The result? You wake up at 2 o'clock in the morning with a full bladder, then again at 4 o'clock, your sleep fragments, your heart never completes its recovery cycle, and you wake up exhausted. Now consider the left side. Lying on your left places the heart closest to the chest wall. The weight of your lungs and chest structures presses against it. For most people, this is unnoticeable. But for anyone with an enlarged heart or pericardial issues, this compression can trigger palpitations and discomfort. The most hemodynamically neutral position for your heart is the right side, with the upper body slightly elevated, roughly 15 to 20 degrees. A wedge pillow or an adjustable bed frame accomplishes this. That slight incline reduces venous return just enough to spare the heart from overload without compromising circulation. Your sleeping position is not a preference, it is a cardiovascular variable. Most people know not to drink coffee right before bed. That is obvious. What is not obvious is how long caffeine actually stays in your body. The half-life of caffeine is 5 to 7 hours. Half-life means the time it takes for your body to eliminate just half of what you consumed. A cup of coffee at 4 o'clock in the afternoon means half the caffeine is still circulating in your bloodstream at 10 o'clock or 11 o'clock at night. You feel tired. You think the caffeine has worn off. It has not. Caffeine works by blocking adenosine receptors in your brain and your cardiovascular system. Adenosine is one of the key signals that tells your heart to slow down and tells your blood vessels to relax and dilate. With caffeine still sitting on those receptors, that signal never arrives. Your heart stays in a mildly elevated state. Your blood vessels remain slightly constricted. The nocturnal dip we talked about earlier gets blunted before you even close your eyes. Nicotine does something similar, but acts faster. Smoking or vaping within 2 hours of bed raises your resting heart rate by 10 to 15 beats per minute and delays the blood pressure dip that is supposed to protect your heart overnight. And here is one that catches people completely off guard. Many over-the-counter medications contain stimulants you do not know about. Certain headache pills include caffeine as an active ingredient. Common decongestants contain pseudoephedrine, which acts like a mild adrenaline hit. Even some herbal supplements marketed for energy or focus contain stimulant compounds that linger for hours. Patients tell me they have eliminated coffee after noon and still cannot understand why their heart races at night. Then we look at the pill they took for a sinus headache at 7 o'clock in the evening, and there is the answer. Here is the critical thing to understand. Any single one of these mistakes on its own might not cause a cardiac event. A little blue light, a slightly late dinner, 1 cup of coffee in the afternoon. Individually, your heart can absorb each of those. The danger is that they stack. Screen light suppressing melatonin, plus a stressful news article firing up your amygdala, plus a late snack diverting blood and spiking insulin, plus caffeine, still blocking your adenosine receptors. Add them together and you have a cardiovascular system that never transitions into genuine recovery mode. Not on that night, not on the next night, not for months. This is the mechanism behind what cardiologists increasingly recognize as chronic nocturnal cardiovascular stress. It does not produce a single dramatic event. It erodes your cardiac reserve gradually, silently. Over 5 to 10 years, vessel walls stiffen, plaques grow faster because inflammation never fully resolves. The electrical conduction system of the heart becomes less stable. The threshold for a cardiac event drops lower and lower, and then one night, one slightly larger stressor tips the balance. A bad dream, a full bladder that jolts you awake, a sudden temperature drop in the bedroom, something your heart would have handled easily 5 years ago now pushes it past the edge. I had a patient, mid-50s else, no prior cardiac history on record. His wife found him at 5 o'clock in the morning, unresponsive, gray, drenched in sweat. He survived. When we sat down afterward and reconstructed his evening routine, every single one of the mistakes I just described was present. Every one. He did not have one bad habit. He had a system of bad habits that compounded night after night until his heart could not absorb one more. Now, the solution. You currently spend 10 minutes staring at a screen before you sleep. I am asking you to replace those 10 minutes with something that actively protects your heart. Not a vague relaxation idea. A specific, timed cardiovascular wind-down protocol. Minutes 1 through 3, controlled breathing. Inhale through your nose for 4 seconds. Hold for 4 seconds. Exhale slowly through your mouth for 6 seconds. This is not meditation. This is not a wellness trend. This is a direct vagal nerve stimulation technique. The extended exhale activates your parasympathetic nervous system, the same rest and digest branch we discussed at the beginning. Clinical measurements show that heart rate begins to drop within 90 seconds of starting this pattern. Blood pressure follows. You are manually initiating the nocturnal dip your body needs. Minutes 4 through 6. Progressive muscle relaxation. Start at your feet. Tense the muscles for 5 seconds. Release for 10. Move to your calves, your thighs, your abdomen, your chest, your shoulders. Each time, tense and release. What this does is clear residual adrenaline from the muscle tissue and send a direct signal to your brain. The body is safe. There is no threat. Stand down. Minutes 7 through 9. A body temperature trick that almost nobody knows about. Warm your hands and feet. Put on socks, or simply rub your palms and feet together for 2 minutes. Warming the extremities triggers peripheral vasodilation. Blood vessels in the skin open wide. When that happens, heat escapes from your core body temperature drops. And that drop in core temperature is the single strongest physiological trigger for melatonin release. You are unlocking the exact hormone that your screen was suppressing. Minute 10. Lie in your chosen position, right side or slightly elevated, eyes closed. No phone, no mental review of tomorrow's schedule. Just stillness. Your heart is now entering sleep, the way it was designed to. The 10-minute protocol is your last line of defense. But genuine nighttime cardiac protection does not start at 11 o'clock at night. It starts the moment you open your eyes in the morning. First, sunlight. Within the first hour of waking, get outside and expose your eyes to natural daylight for 10 to 15 minutes. You do not need to stare at the sun. Just be outside. Morning light hits your retina and resets your suprachiasmatic nucleus, the master circadian clock. That reset is what ensures melatonin releases on schedule 14 to 16 hours later in the evening. Skip the morning light and the entire hormonal timeline shifts. Melatonin comes late, cortisol lingers, and your heart misses its recovery window again. Second, move during daylight. 20 to 30 minutes of walking, which I have covered extensively in previous videos, improves vascular elasticity, lowers your baseline blood pressure, and trains the cardiovascular system to transition smoothly into rest mode when night comes. A heart that has been properly loaded during the day recovers more efficiently at night. A heart that sat still for 16 hours does not know how to switch gears. Third, your last caffeine of the day should be no later than 1 o'clock in the afternoon, not 3 o'clock, not 2 o'clock, 1 o'clock. That gives your body a full 10 hours to clear enough caffeine so that adenosine can do its job by bedtime. Fourth, your last full meal, at least 3 hours before you lie down. If genuine hunger is an issue, a small handful of raw nuts, almonds or walnuts, they contain magnesium, which stabilizes cardiac rhythm and supports smooth muscle relaxation. Fifth, check your medications. Ask your doctor specifically whether any of the pills you currently take contain stimulant compounds and whether the dose can be moved to morning. That single conversation could change the quality of every night that follows. Now I want you to pay close attention, because your body may already be telling you that your heart is not recovering at night. You just have not been taught what to listen for. The first signal. You wake up in the morning and your resting heart rate is above 75 to 80 beats per minute. Check it before you get out of bed. A heart that recovered properly overnight should be at its slowest and calmest in that moment. If it is already running fast before your feet hit the floor, it never fully rested. The second signal. You sleep 7 or 8 hours and wake up feeling like you slept 3, not groggy from oversleeping. Genuinely unrested, heavy, drained. That is not poor sleep quality in the conventional sense. That is a heart that worked all night instead of recovering. The third signal. Night sweats without fever and without menopause. Unexplained sweating during sleep can indicate that the sympathetic nervous system is firing when it should not be. Your body is in stress mode while you are unconscious. The fourth signal. Waking up gasping or with a sudden sharp jolt between 2 o'clock and 5 o'clock in the morning. Not from a nightmare. From nothing. Your eyes snap open, your heart is pounding, and you do not know why. The fifth signal. Your blood pressure is higher in the morning than it was the evening before. This is called reverse dipping. In a healthy body, morning pressure should be lower than evening pressure. When it is the other way around, something prevented the nocturnal dip entirely. The sixth signal. Persistent palpitations or skipped beats when you lie down. If any of these are present, a conversation with a cardiologist is warranted. Ask specifically about overnight pulse oximetry, Holter monitoring, and an echocardiogram. Do not wait for chest pain. Chest pain is the final symptom, not the first. Everything I just walked you through, the habits, the protocol, the warning signs, that is your foundation. But I know a lot of you watching right now are already thinking the same thing. I need to get checked. I need to find out where I actually stand. And that is the right instinct. The problem is, getting into a cardiologist's office takes weeks, sometimes months. And most of what we talked about today will never come up in a standard 12-minute appointment. There is no billing code for teaching you how to go to bed. That is why I want to tell you about something that has been helping thousands of people who watch this channel. It is called Care Health. Care Health is a platform that connects you directly with clinical trials and innovative treatment options in your area. You answer a few basic questions: your name, your zip code, your age, and within 30 seconds the platform shows you what is available near you: cardiovascular screening studies, advanced heart monitoring programs, metabolic health evaluations, the kind of deep dive testing that would otherwise take months to schedule and cost thousands out of pocket. Many of these trials offer comprehensive evaluations at no cost to you. This is exclusively available to U.S. residents. If you are in the United States, you can sign up right now. Go to my channel page and you will see the Care Health link right there. If you are watching on your phone, tap my profile picture. It takes you straight to the channel page, and a screenshot is appearing on screen right now showing you exactly where to find it. If you are on a computer or a TV, a QR code is on screen. Open your phone camera, point it at the square, and tap the link that pops up. Takes 30 seconds. I have to be straightforward with you. Spots fill up fast. Thousands of viewers from this channel have already signed up, and the openings in your area are not unlimited. Clinical trials accept a fixed number of participants, and once they are full, they close. I have seen people come back a week later and find that the trial near them was already at capacity. Do not put this off. If your heart is showing any of the signs we discussed today, if you are over 40 and you have not had a proper cardiovascular workup, this is your window. Care Health will not be available forever, and neither will these specific openings. Your heart does not send you a calendar reminder before it fails. It sends the quiet signals we covered today, and it expects you to act. This is me telling you to act. Check out Care Health on my channel page. It could be the single most important thing you do for your heart this year.